Ow. Ow. Ow.
Oh dear. Now, that's it. There we go.
In 1895, a physicist named Wilhelm Röntgen was doing experiments with a cathode tube, a glass container in which a beam of electrons lights up a fluorescent window. He had wrapped cardboard around the tube to keep the fluorescent light from escaping, when something peculiar happened. Another screen outside the tube was glowing. In other words, invisible rays had passed through the cardboard. Wilhelm had no idea what those rays were, so he called them X-rays, and his discovery eventually won him a Nobel Prize. X-rays are powerful enough to fly through many kinds of matter as if they are semi-transparent, and they're particularly useful for medical applications. All the time in a procedure called a CT, computed tomography scan, another Nobel Prize-winning invention. Think of CT like this. With just one X-ray, you might be able to see the density change due to a solid tumor in a patient, but you wouldn't know how deep it is beneath the surface. However, if you take X-rays from multiple angles, you should be able to find the tumor's position and shape. A CT scanner works by sending a fan or cone of X-rays through a patient to an array of detectors. The X-ray beam is rotated around the patient and often also moved down the patient's body, with the X-ray source tracing a spiral trajectory.
Well, what exactly is an MRI? An MRI, which stands for magnetic resonance imaging, is a technique used to generate an image of one's body non-invasively. When undergoing an MRI scan, a patient lies on a movable bed which is surrounded by the MRI scanner and a circular magnet. Radio waves 10,000 to 30,000 times stronger than the magnetic field of Earth are sent through the body. As we all know, our bodies are mainly composed of water, which contain hydrogen atoms. These waves cause the nuclei of the atoms to change position. As the nuclei move back into their original positions, they emit their own radio waves, which the scanner picks up and ultimately turns into a picture that is seen on a computer. For the most part, this procedure is painless and risk-free. It should be noted that pregnant women or anyone with a pacemaker or any sort of metal implant cannot do an MRI scan due to its powerful magnetic force. A positron emission tomography scan is performed by using a special dye that has radioactive tracers. The patient injects this tracer and it is subsequently absorbed by organs and tissues in the body. The PET scanner can highlight these tracers and see how well organs and tissues are performing. PET scans can therefore measure blood flow, oxygen use, and glucose metabolism. A major difference between PET scans and the two previous scans is the ability of a PET scan to show problems and complications at a cellular level. The resolution might not be as clear as an MRI or CT scan, however it gathers more functional information. To prepare for a PET scan, the patient must notify their doctor about any medical conditions and if they are pregnant. In some instances, it is advised that the patient does not eat for 8 hours prior to the scan. Risks associated with a PET scan are similar to those of a CT scan, including exposure to radiation and allergic reactions to the injected tracer. The MRI, CT scan, and PET scan are three of the most commonly used techniques for medical imaging. We learned the benefits associated with each, such as the high resolution provided by the CT scan, or the functional information given by the PET scan. Furthermore, we also learned about the disadvantages and risks associated with these scans, such as the possibility of an allergic reaction to the tracers in a PET scan, or the exposure to high radiation in CT scans. In conclusion, the benefits outweigh the risks in all three of these scans, as they provide essential information for patients and healthcare providers in need of help.
Screening for breast cancer, mammography. Screening mammograms are X-rays of the breast that look for breast cancer in women who do not have any symptoms. Mammograms help find cancer when it's small. Early detection means more treatment options and a better chance of recovery. The BC Cancer Agency recommends that women between the ages of 40 and 74 with a mother, sister, or daughter with breast cancer have a mammogram every year. Those without a family history between the ages of 40 and 74 can have a mammogram every 2 years. Talk to your doctor about the benefits and limitations of mammograms to find out if screening is right for you. When you go to a BC Cancer Agency's screening mammography center, wear a two-piece outfit that opens in the front and avoid using deodorant, perfume, or lotions. When you arrive at your appointment, you will be asked to fill out a simple questionnaire. Next, you will be taken to a changing area where you will remove all clothing from the waist up. After removing your bra, you may then put your shirt back on. Next, your female mammography technologist will take you into the exam room. She will then begin by positioning one breast at a time on the machine and will use a plastic plate to hold it in place. You will feel some pressure for a few seconds that may be a little uncomfortable. This pressure is necessary to stop any motion and spread the breast tissue for the best picture. In 2 weeks, your results will be sent to you and your doctor. You may be asked to return for additional testing to look more closely at a specific area. This does not mean you have cancer. 95% of women who require further testing do not have cancer. Make breast screening a part of your regular health routine. Research has shown a 25% reduction in deaths among women who screen regularly.
A coronary angiography, or cardiac catheterization, is an X-ray examination of the vessels and chambers of the heart, often done to identify any narrowed or clogged coronary arteries that are preventing blood from reaching the heart muscle. The study can also be used to measure the size and function of the chambers of the heart and the function of the heart valves. When you arrive at the hospital, an intravenous line will be started. You will be placed on a heart monitor, and you may be given an oral or intravenous sedative to help you relax. Most coronary angiography procedures last between 1 and 2 hours. Before the procedure, you will be placed on a table equipped with a fluoroscope, an X-ray imaging device. During the procedure, the fluoroscope will move around your chest in all directions to record pictures of your heart and coronary arteries from multiple angles. Most cardiac catheterizations take place through the femoral artery in the groin, but can also be done through an artery in the arm. The doctor numbs the skin in your groin area and inserts a needle into your femoral artery. Once the needle is placed, a wire is passed through the needle and gently guided through the arterial system to the heart. The needle will be withdrawn and exchanged for a small flexible tube called a sheath that permits access to your femoral artery. Next, a soft, flexible catheter will be slipped over the wire through the sheath and threaded up to your heart. Your physician will watch the movement of the catheter on the fluoroscope. You may feel pressure as the wire and sheath are inserted, but you will not feel their movement inside your arteries. To evaluate the coronary arteries, your doctor will remove the guide wire, position the tip of the catheter just inside the arteries, one at a time, and inject a special dye. This dye allows the fluoroscope to take X-ray images, called angiograms, of the artery's interior. Any blockages will be clearly identified as the arteries fill with dye. You may feel flushed or slightly nauseated when the dye is injected. After sufficient images of both coronary arteries and their tributaries have been recorded, the catheter will be removed through the groin. Pressure must be applied over the femoral artery to prevent bleeding. You will then be taken to the recovery room for 30 to 60 minutes of observation, after which you will be required to lie on your back for several hours with a pressure bandage in place over your groin. You may either be discharged home on the same day or after an overnight stay in the hospital.
Can make images of organs, like bones, without harming them, although they do have a small chance of causing mutations in reproductive organs and tissues like the thyroid, which is why lead aprons are often used to block them. When X-rays interact with matter, they collide with electrons. Sometimes the X-ray transfers all of its energy to the matter and gets absorbed. Other times, it only transfers some of its energy, and the rest is scattered. Or if it's made of elements with higher atomic numbers, which means more electrons. Bones are dense and full of calcium, which has a relatively high atomic number, so they absorb X-rays pretty well. Soft tissue, on the other hand, isn't as dense and contains mostly lower atomic number elements like carbon, hydrogen, and oxygen. So more of the X-rays penetrate tissues like lungs and muscles, darkening the film. These 2D pictures are only useful up to a point, though. When X-rays travel through the body, they can interact with many atoms along the path. What is recorded on the film reflects the sum of all those interactions. So what began as Röntgen's happy accident has become a medical marvel. Hospitals and clinics now conduct over 100 million scans each year worldwide to treat diseases and save lives.